Biology, Physiology, Biophysics, and Molecular Medicine. I'm director of the Ehlers-Danlos Clinical Research Program at Boston University School of Medicine.
All right.
I am a licensed physician in the state of Massachusetts, and I am a mandated reporter for child abuse. I do not promote child abuse. So how did this all begin? 1969 at the University of Wisconsin, I was given the responsibility to identify the major circulating form of vitamin D, which I did in 3 months. So if you go to your doctor to get a vitamin D test, I'm the guy that discovered it. Also, a year later, I got my PhD degree. Why? Because I identified the active form of vitamin D that's made by your kidneys. We began to realize that kidney failure patients, the reason they had such severe bone disease, they couldn't activate vitamin D. I'm an organic chemist. My roommate and I, as a graduate student, we were the first to chemically make it. And the material that we made, we gave to pediatricians and adult doctors of children that not only had kidney disease, wheelchair-bound, and began to walk again, but also a rare disease of rickets, where these children couldn't activate vitamin D. And what I provided to these children cured them. So by 1972, I was recognized as one of the world's leading experts in the field of pediatric and adult metabolic bone disease. 1987, I was recruited by Boston City Hospital, then it became Boston Medical Center, to be chief of endocrinology, nutrition, and diabetes. I was director of the General Clinical Research Center, responsible for all clinical research at BU. And they asked me to set up a pediatric and adult metabolic bone clinic, which I did. And I was its director until 2021. How did I get involved in this? In 2010, I received a phone call from a mom, desperate for help. And she said, I need your help. And I said, how can I help? And she said, I have been and my husband accused of child abuse. And I said, I don't know anything about child abuse. I don't know how I can help you. And she said, my son had bone fractures. You're one of the world's leading experts. Please see us. And I did. And I wound up seeing this family and realized that the mom and the child had Ehlers-Danlos syndrome. I have been writing about Ehlers-Danlos syndrome since 1980.
Wow.
We know that this genetic disorder increases risk of fractures more than twofold in children and adults. And so I got to see the family. I went to family court, and actually the family court listened to me and gave the child back to the family. I followed that family for 8 years. Now here's the problem. I received a phone call from a woman in Minnesota, and she was distraught. And I have a Ehlers-Danlos clinical research program. And I don't just willy-nilly take phone calls and Zoom calls and just assume that, there's no issue here. I carefully vet them. I ask them lots of questions and have them fill out a questionnaire. And so I talked to this mom, and I said, I need to talk to you and your husband. And she said, you can't talk to my husband. And I said, why? So then she told me her story. So she has 2 children at home and a 6-month-old that had a bruise. Her and her husband, who is a fireman locally and captain of the Navy originally, they went to the hospital thinking that the pediatrician would come out and explain what was going on. Instead, 2 detectives showed up, put them in handcuffs, took them to the police station, and interrogated them for the next 8 hours. And so finally the detective convinced the husband, look, maybe you squeezed the infant a little bit too tightly, you were tired one day, you take some parenting classes and everything will be fine. And so he did, he signed the dotted line. And sure enough, he was instantly accused of felony child abuse, wife permitting it, 2 children at home gone, and 6-month-old taken away and put in the grandparents, paternal grandparents' care. The father was so distraught, he didn't know how he was going to get his children back. So he decided there's only one way. So he wrote a note saying, I did this, I apologize, all right, give the children back to my wife, and he committed suicide.
Oh my God.
Oh, that's not the story. Oh, no. She is 12 weeks pregnant. She gives birth, breastfeeding her infant, her daughter. 5 days later, DCF shows up and takes her infant away and puts in foster care. Also, during the time that they were in parental grandparents' care, they developed some bruises, the infant's child. So now, not only are the parents child abusers, but even the grandparents are child abusers. And they were taken away and put into a group foster care home. She went to court and lost twice. And then ultimately, she went to the Supreme Court, appealed, and finally got her kids back. But she no longer has a husband. I received over 400 emails requesting my help. I sent off this questionnaire to all, and I've helped well over 100 families be reunited.
Wow.
However, 2015, I kept my hospital fully informed, and they were congratulating me for my help. And then all of a sudden, I got 2 families in Massachusetts that asked me for their help. And I testified opposite the pediatricians at my hospital. So whereas my hospital was fully in favor of my activity, they turned 180 degrees. And I was told that the board of trustees of the hospital and the CEO of the hospital, they said, we've got to get rid of this guy. And so then, even though I'm the world's leading expert in this area, and Google Scholar, I published over 900 publications. I have over 100,000 citations. Meta GPS Scholar reviewed 20 million scholars, 300 million publications, and they recognized me as #1 in endocrinology, #1 in vitamin D, and #2 in the world for bone. However, I'm told by my hospital I can no longer see pediatric patients. And so I gave a Daubert hearing, right, a pre-trial hearing. My expert report was taken by the child abuse expert and sent to a child abuse expert in Yale, who then sent it to my chief. And since they said I couldn't make a diagnosis in an infant, I got the phone call that I'm going to be fired. I went in front of the medical advisory committee, ad hoc committee. They said they were going to terminate me, but then they said, well, they're going to actually put me on leave for 9 months. But they said, wait, because you can go in front of the ad hoc committee for the board of trustees. They didn't introduce themselves. They gave me 15 minutes. And a couple of hours later, I received a letter saying I've been terminated from Boston Medical Center. Right? I remain as professor of medicine at Boston University School of Medicine. I still have my clinical research program. And I have now over 600 DNA samples trying to raise money. We've published 3 papers now on the genetics of Ehlers-Danlos syndrome and mast cell hypersensitivity. Finally, why am I doing this? I'm 79 years old. I have stage 3 prostate cancer, the most severe form. Right? I went to the courts, right? Lost all of my financial welfare, basically. Also, the bank now owns my home. And so my wife, being quite distraught about all this, almost lost my marriage in 53 years. And it was actually a Christmas miracle that saved it, and we are now stronger than ever. voters, men and women listening to this, right, why am I doing this? Right, because my family asked me the same question, and the answer is simple. And I think Senator John Lewis made it very clear. He said, when you know something is wrong, you are obligated to help make it right. And I'm a physician, do no harm, and as a result, even over the weekend, I got 2 more cases. I get a case or 2 every week of families still trying to contact me. So thank you very much for listening to me, and I have a good day.
Our next expert is Veronica York. Veronica is nationally recognized domestic violence, DV and child abuse custody expert. Her partner is Goldstein and York, which is Barry Goldstein, DV Experts, LLC, qualified in 10 states to provide expert testimony in domestic violence custody cases. Trained family law mediator, certified high conflict divorce coach, extensive experience educating courts, professionals, and communities on evidence-based research to protect children in high-risk custody situations. Expertise in impact of DV on children, adverse childhood experiences, which is ACE, research, U.S. Department of Justice Saunders study, primary attachment research, shared parenting, child sexual abuse, and gender bias in family court proceedings. Misuse of parental alienation, my favorite annoying subject. Let me add the word syndrome. Let's say it together. And then coercive control and Darvo tactics. Everybody welcome Veronica York.
It is so nice to be here, and just having everyone together is wonderful, and thank you so much, Doctor, for the work you've done. And I know firsthand the retaliation that you get when you are an advocate, when you stand up for what's right. But we still do it because that's what we have to do for our children. So thank you for the introduction. Thank you, everyone, for being here. The first thing I want to do is just provide a little bit of context for the situation. I think that we're all in. We're going to hear a lot of your stories, and I think this context helps people understand who are outside of our bubble, who don't get it. Because even when I was outside of the bubble, I didn't get it. It wasn't until I became a victim of the family court system that I understood what was really going on. So there's 2 contexts. The first one is that most contested custody cases are handled amicably, settled out of court. You have 2 good, safe parents. There's a very small percentage, less than 4%, that require trial and all the other things that go along with that. And 75 to 90% of those cases are domestic violence and child abuse cases. So when courts are looking at all of their docket, they're seeing mostly cases where they can use standard court practices. These small percentage of domestic violence cases are different and have to be handled differently. And they don't understand that because they're not using evidence-based research when they're doing their cases. They're using the same old standard court practices that have been developed back in the 1970s when there was no research about domestic violence and child abuse. So with that context, we are looking at a very specific paradigm shift that needs to happen in family court, because I believe that judges don't want to hurt children, ultimately. Obviously, there are those that do. But for the most part, judges are trying to do what's best for children, but they do not have the tools, nor the knowledge, nor the expertise to do it. So as an expert witness coming in, I'm trying to provide them with the evidence-based research to help them do their jobs more efficiently, more effectively, and these cases can be settled or ruled on very quickly with this information. They don't have to drag on for decades and decades, but the problem is is when we're appointing guardian ad litems, when we're appointing custody evaluators, parenting facilitators, all therapists, all the stuff. It's a money train, and they don't want that money train to stop. So we're dealing with that too. The other context I wanted to quickly provide is that 99% of these cases is that during the relationship, the father wanted or demanded the mother provide the majority of the child care. When the mother decides she's had enough of the abuse, she wants to report as abuse, she wants to leave, and she leaves the relationship, the father then says, she's crazy or she's alienating my children. And to the court system, that sounds like she's an unfit parent. But the reality is that the abuser is the unfit parent. And so that context is extremely important in family court because abusers are able to manipulate the court system because of that specific context. And so with research like ACE, she mentioned adverse childhood experiences, we can show courts that the well-being of the child should be the first priority is the health and safety. And you can't do that without the ACE research because the ACE research fundamentally says that children who are exposed to domestic violence and other trauma, like child abuse, will live shorter lives and face a lifetime of health and social problems. So your children are experiencing anxiety, depression, low self-esteem, suicide, all of these things because they've been exposed to domestic violence. And we are not talking about physical violence. Courts think domestic violence is physical violence, and on the criminal side, it can be. But in family court, it's the stress and fear that abusers cause. So that stress and fear is what we have to look at in family court and how that impacts the child. Because that stress and fear is what's going to ruin their lives. And courts don't get that. And so they're looking at all these best interest factors, and they are looking at, because they don't understand domestic violence, they're minimizing that impact, and they're looking at other factors that are just not as important as the child's health and safety. So we need to get that as the first priority. The Saunders study out of the U.S. Justice Department was a study that assessed the domestic violence knowledge of judges, lawyers, and evaluators. Because custody evaluators are the mental health professionals that courts rely on, depend on for information. And the problem is that custody evaluators do not have the specific knowledge and expertise needed to recognize and respond correctly to domestic violence and child abuse. So they're not screening for domestic violence. What they're doing is they're using psychological tests that are not telling us anything about domestic violence, and they're pretty much making abuse victims out to be the perpetrators because, again, abuse victims are going to have PTSD, they're going to have anxiety, they're going to have a lot of issues caused by the abuse. And so we need to understand that. And what Saunders is saying is that we need to have specific knowledge in 4 areas in these cases. So that does include screening for domestic violence. It includes risk assessment. It includes post-separation abuse, because abuse does not end when the relationship ends. They use the court system to continue that abuse. And you need the impact of domestic violence on children, which is ACE. So without that knowledge, the courts are using the wrong professionals and the wrong experts. So how can we protect children when we're not using the right experts? So as an expert in domestic violence, we want to create this multidisciplinary approach in family courts. Honestly, you don't even need a custody evaluator. Custody evaluators are making things worse because a lot of them are proponents of the false and pseudoscience parental alienation syndrome. And what is really good parenting by a mother is looked at as parental alienation because they're trying to protect their children from further abuse. And that parental alienation syndrome is being touted by fathers' rights groups who are usually the abusers, who are trying to get across the 50-50. And as Francesca said earlier, shared parenting, the Saunders study specifically found that shared parenting is not appropriate in domestic violence cases for very obvious reasons. And when we impose things like shared parenting, what we're doing is we're giving the abuser all of the power, because there is an unequal balance of power, obviously, between an abuser and a victim. So shared parenting can never work in those cases. I'll briefly talk about gender bias, because in family court, I think the perception is that family court's biased against fathers, but the truth is, it's very biased against mothers. And the reason for that is that they're giving mothers less credibility. There is a study called the Bala study that says that mothers in contested custody cases make deliberate false reports less than 2% of the time. And courts are disbelieving mothers, particularly when they're accused of parental alienation, 98% of the time. So you can do the math and figure out that mothers are always they're biased against mothers, particularly when they report abuse. And because of that, they're holding women to a higher level of proof, standard of proof. They're giving women less credibility, and they're blaming them for the actions of their abusers. And of course, they take a mother's emotion and frustration and anger in dealing with her abuser all out of proportion to what it says about her parenting. So they're looking at basically her reaction, her normal reaction to the abuse, and calling her the actual perpetrator, which is part of DARVO. And I won't go into that, but that's deny. The abusers use that tactic. It's deny I'm the abuser, attack my victim, and then reverse victim and offender. So I will briefly say that in regards to shared parenting, I've been hearing from fathers' rights groups that Kentucky, which was the first state to implement the presumption of 50-50, they're touting the statistic that, divorces are way down in Kentucky because we have 50-50. Well, yeah, because you're making it much harder for victims of abuse to leave their abuser. Why would we leave our abuser if we can't protect our children from them? At least if we stay, then we can be there to protect them. So my advice to those fathers' rights groups is to take a look at the homicide rates in Kentucky and DV homicide rates to see if they're going up, because I can guarantee that they are. They're going up in a lot of states because of these 50-50 presumptions. So I definitely wanted to point that out. The last thing I'm just going to talk about is that, as experts, we are really trying. I know there's a lot of talk about, courts educate. What do they need? Do they need education? Do we need to just, drop the whole system? I mean, yes, all the above, right? We need to do anything that we can to educate, to change the system, to get this act passed, to scream it to the rooftops, because we're dealing with, and we often compare what's going on in family court with what happened with big tobacco back in the 1960s, when the Surgeon General's report came out and said, hey, tobacco links smoking and cancer. And with family court, the ACE research, we're linking adverse childhood experiences to diseases like cancer and heart disease. Because you know why? That stress and fear, if you think about it, if you go to the doctor and you have a heart problem, they're going to say you need to reduce your stress. We're putting children through all this stress, and it's causing them lifelong issues. The life expectancy of a child who's gone through this is 20 years less than a child that hasn't gone through the family court system and dealt with these adverse childhood experiences. So we really need to use our voices in every aspect of society, the medical profession, the legal profession, the education profession, media. All aspects of society need to come together, just like we did with cancer and smoking, to let everybody know this is a health risk, this is a problem, this is a major issue. And Barry and I, along with Dr. Mo Treescanna, have a book coming out later this year where we're talking about all of this and all aspects of society and how we can all help to prevent domestic violence and child abuse, and particularly in child custody cases, because that's where the majority of these children are suffering and being murdered because they're being sent to live with their abusers. Thank you so much.
By the way, if anybody sees a black pocketbook with some sparkle, that's mine. I can't find it anywhere. Oh, thank you. Okay. Okay. Thank you. Tell Kristen to come back. Okay. The next expert on the list is Amber Brown, BSSWBT, medical social work and case management expert with training in civil and criminal procedures, appellate review, criminology, juvenile delinquency, Maryville University, St. Louis, Missouri, administrative law, Johns Hopkins Carey Business School, experience in human identification cases in the state of Missouri with Dr. Aaron Oji, and trained in bite mark identification by Dr. Richard Hudson Somion, known for his work on the Ted Bundy case.
I don't frequently speak with a microphone, so this is weird. I don't speak with a microphone very often, so this is a little weird for me. But I wanted to come here and testify because I was also a victim of the family court system, and then that was utilized against me to harm my profession, medical social work. So as you can see, I as well am fairly educated, and I went on to work for Novant Health Center in Wilmington, North Carolina. While I was there, I had started my work on the med-surg floor, so you get a various array of different types of cases. I worked in the adult ICU and pediatric ICU, and before I was transferred over to the pediatric ICU, I was told I was taking a position of a medical social worker, and she had suffered abuse from the physicians while she was working over there. So I kind of talked to her a little bit about it. I was a little nervous to go over there. She told me that they used her to make CPS reports, and they thought that that was her only purpose. So working in case management, you're supposed to collaborate together. Social workers are very undervalued in the medical system. We are the ones, not all of us know a significant amount about law, but I would say if it is a real deal social worker, they're not going to purge in a report to violate someone's rights and take their child away. And me, I'm ethical. I know, the ethics that I stand behind. And I knew that whenever I wanted to work with these kids over in the pediatric ICU, they weren't going to be telling me to make false child protective service reports because, well, I went to Johns Hopkins and I know the law. So. What ended up happening was, while I was working, I started to notice that there were specific cases I would not be consulted on. So some of these cases, like whenever I went through and I read, the medical documentation, I was just like, why am I not being consulted on this? And I would go down and I would find out that it was a white child, the family was wealthy, and then sometimes they were related to the physicians or the nurses, or there was some type of a relation in that area. It's kind of I would say a smaller area where everybody kind of knows everybody. And the kids would have some type of relation to the people, and those were children who were on life support for neglect. And so I would consult myself on those cases, and I would go in and I made the reports that needed to be made on those people because they endangered the welfare of a child, and that was so then there were times where I would notice that if a family was lower income or it was an African American family, they would be particularly harmful to them. And in one situation, I went and I spoke with the mother. It was an African American mother and African American father, and they had a brand new baby. The baby was a couple weeks old, and the baby had a condition. I went in and I looked at my own research. The baby had a condition called it was biliary stenosis, I think. And that condition is something where I think it starts to show maybe like 10 to 12 days after the baby's born. The baby was only 2 weeks old. So I called over to the pediatrician. I ensured that the mother was, taking the baby to the doctor. She was doing everything she was supposed to be doing, and she did. She did everything she was supposed to be doing. The parents were under a lot of stress. They got into an argument in the room, and a nurse accused the father of punching the mother. I went in and I talked to the mom, and I even talked to the grandpa. He was on the cell phone. They were great people. The grandpa was there caring for her other 2 children. She had everything in line that she needed to be doing. She owned a business. She was doing everything she needed to be doing as a mom. And she told me that he did not punch me. We got into an argument. He did not punch me. We were yelling at each other. Well, anytime they're yelling, I do have to make a report on something like that because you're not supposed to be having altercations around your kids. And I did make that report. But then what happened, I think the day after that, the child abuse pediatrician came in and she read through my notes and she asked me why I didn't make a report on medical neglect. And I was like, why would I make a report on medical neglect? I had literally done everything to make sure that, this was a medical condition. It wasn't some type of neglect, and it was 100% a medical condition. And there was absolutely no neglect. The mom did everything she was supposed to be doing. They told me this physician, she never even did an assessment on this mother. She never went in, never talked to her. I talked to her, and she's telling me she's codependent. I was like, this lady is not codependent. She is not codependent at all, and I don't know how you can say that whenever you haven't spoke to her. So I stated to her, I said, have you testified in front of a court? And she goes, well, yeah, I've been in there 1,000 times. I said, well, do you know what perjury is? Woo! Anything like that. So my time did not last very long there. But you know what? I will take a firing over somebody losing their child, okay? So,
Amen.
I did what I had to do.
Yes, girl.
Also, I would say my feelings are so strong about that because, like everybody else here knows, I know what happens to those kids. And when I know that children are put in homes with criminals who make them pee in pools of pudding and eat it for food, I'm not sending kids there.
Oh my God.
So
Damn straight.
yeah.
That's right.
And that is a true case. That case is actually on YouTube. So if Congress wants to view it, they can view that. There's also additional cases on YouTube where there are parents who utilize children for food stamp money, and they will lock the refrigerator, and you will have this overweight foster parent who is eating all of the food, and you'll have starving children. So that really doesn't make sense to me. But
Boo.
so I made sure I just evaluated every single person that I ever work with, and that's what I do now. I do it in my own time. If there is a parent who they have had a child taken because of false medical abuse and neglect, like allegations, I will evaluate the case, and I just was able to reunify my 5th child this past week. She came through actually with Francesca. Francesca told me to work with her. I worked with her, and I got the senator. It was the commissioner involved, and the baby is going to be reunified, and they were not going to reunify the baby. They were going to adopt the baby out, and that brings me to my last point on this. With genetic, a lot of issues come with some of these reports. In the pediatric ICU, you get a lot of failure to thrive babies, and those babies require a lot of testing before you can accuse someone of not feeding their child. They don't do that. They will put the families in a room, they will give them a bottle, and they will start watching them to see if they're feeding the baby. But then sometimes if nurses are very nasty, which they can be, they will make false statements stating that the mom is not feeding the baby, and that all gets documented, and that becomes a part of a legal record. So, and then that hurts them for the rest of their life. But I have seen that myself. And so, whenever you have a kid who has a genetic disease, I'm going to talk about POLG, mitochondrial disease. I have POLG, and my children have POLG, and I was falsely accused of munchausen by proxy. So with Polgy babies, it's about, I think, 84% of those children have difficulty feeding, and let's see, 87% of them have liver involvement, 84% have seizures, 84% have neuropathy. They have varying issues that go on, and you're lucky if you get a diagnosis very early on. It took us about 4 years to get a diagnosis for my son. But this is kind of where the issue comes in, is that these providers don't put in referrals to genetic physicians, and a child abuse pediatrician is not an appropriate person if they do not have training in genetics to be giving advice on metabolic disorders or anything, even in relation to what our physician here has talked about. You have to have a specialized education in these things to be really sure that what you're doing is right, but they require multiple specialists, and the parents don't get the justice that they deserve. It's just an automatic, immediate referral to Child Protective Services. These kids are some of the most complex kids who they need to be having urgent care, not delayed care. In the foster care system, Child Protective Services, they are delaying medical care for these kids. And then the other thing that I've seen in the hospital setting is that if you were a parent were to bring your kid into the emergency room and you said, I'm going to go on a cruise, I need you to watch my medically complex kid, they're going to call Child Protective Services on you. I literally had foster parents bringing their children into the pediatric ICU, and they were leaving them there so they could go on cruises, and social services would back them up and support them, and it would create a problem for me in my work, because my job was to get them out of the hospital, and I could not get them out of the hospital whenever social services was encouraging them to utilize the hospital as a hotel room. Wow. It is, and so with all of that, whenever I made my own Child Protective Service report, because I'm a mandated reporter, that information usually gets sent to the hospital. But because I had my own CPS case, whenever I had to call Child Protective Services on my ex-husband, they were sending patient information to my home. So I had to tell my supervisor that this information was coming to me, and I didn't know why. They had a social worker go in and see that I had a case before, and they immediately started trying to terminate me from my position. And for that, and then also not making the false report. But they had probably a page of 12 different allegations against me, and that's, kind of where that ended. But overall, I think that is all I really have to say, and I, appreciate everybody for coming here, and I hope that we can really make some change in all the different areas where we have some very significant problems. I hope Congress takes this serious, and I hope you support the Family Justice and Accountability Act.